encourage all of you to continue to use the social media things we tested out last week, the skills you learned with Twitter and commenting on the website. Nandita's going to play the role of moderating these comments and introducing online comments into our conversation. So this will be good practice for her for when we go live in May, where we'll have a lot of online webinar participants. Today's topic is about narrative and oral history and what role narrative plays in medicine. Oral history has been around for ages. It was the first, how we recorded history was orally before there was written word. And it has always played a role in defining culture and for us to understand people from different cultures, from different times in history. And in the modern age, it is also integrated with medicine more recently. And going back to maybe someone who you may be familiar with, Studs Terkel. He is an American who really documented stories of Americans from all walks of life, and documented people from World War I, addressed racial issues in our country, and just really opened up the world of oral history, I think, into the mainstream. I'd like to start off with some quotes from him because I thought they were very apropos to what we've been discussing. And I posted them on the web earlier so that people could see them. Let's start with. So one thing he said is, when you become part of something, in some way you count. It could be a march, it could be a rally, even a brief one. You're part of something and you realize you count. To count is very important. Another quote that I find really interesting is, that's what we're missing. We're missing argument. We're missing debate. We're missing colloquy. We're missing all sort of things. Instead, we're accepting. And then more recently, he wrote, I'm not up on the internet, but I hear that is a democratic possibility. People can connect with each other. I think people are ready for something, but there is no leadership to offer it to them. People are ready to say, yes, we are part of a world. So I think all of these quotes really emphasize the individual story, the person. And as doctors and as other professionals, we deal with people all the time, and these stories really help us interact with people and have an honest relationship with people in whatever we do. Some of the questions I'd like people to think about during this discussion are, how do oral histories broaden our understanding of public health issues? In this case, 9/11. How can they deepen our scientific inquiries? How can patients teach us about illness, and how can they teach us about recovery from those illnesses? And what impact of documenting stories have on our patients or people who are telling the stories? One thing I know Nandita passed out to all of you is a copy of what we call the PCL. It's an inventory of PTSD symptoms or post-traumatic stress symptoms that is used quite commonly in both research and in the clinical setting. And we utilize this at the World Trade Center Health Program to help us just have an understanding of patients coming in, whether or not they may need care, or we use it in terms of research to try to understand how exposure has affected people. And I wanted just to do a comparison between something that is very scientific and medical and clinical to something that is narrative, to just kind of demonstrate a point. So as you see with the PCL, it's a list of questions. They're clinical questions that talk about common symptoms people might have, from nightmares to flashbacks to agitation and sleeping problems. And all these symptoms make up a constellation that we refer to as post-traumatic stress disorder.
what is that scale called, Julie?
So this is a self-administered questionnaire. So a person would review these questions and answer which question would most likely reflect how they're feeling.
This is the PCL?
And it's called the PCL, or it is also known as the patient checklist, the patient checklist. And it measures the level of stress symptoms related with a traumatic incident. And the patient or whoever's filling it out is asked to rate that symptom based on a scale that never really happens to it happens a lot. And depending on how often it happens, clinicians and doctors, we make decisions on, whether or not this is significant, and the person might need to be assessed further or may need assistance. And these are common symptoms. They're very, they're defined based on a manual that psychiatrists and psychologists use to diagnose a syndrome. So I'd like to compare that to this text that I'm going to read right now. And it's from a story by Rob, who's here with us today. And he, this is near the end of his chapter when he's told us what his day has been like on that day of 9/11 and what he's been through. And then now he's reflecting on how that's impacted him 10 years later. And he works in the city. He's an accountant who goes there for work. And just kind of like a day, what a day could be like for him. I'll tell you, when you work in the city, a lot of times you walk past a lot of the delis and they have flowers out front. And I couldn't walk past them because the smell of the flowers was just like being in another funeral home. So I remember I couldn't walk past the delis. I couldn't go to the Home Depot. People are like, Home Depot? You gotta understand, ash was a lot like sheetrock. And it had that same smell, and I couldn't deal with that. I couldn't look at bacon for at least a year. Again, it goes back to when the woman was on fire. That's what she looked like. I just couldn't deal with that because at that time, at 33, I was afraid of the dark because everything went black in the firehouse. I couldn't see a hand in front of my face. So anytime, nighttime, forget about it. Nighttime was awful because everything was just dark. There was a lot of time not sleeping, and I just kind of fall asleep during the daytime. I'd like us to think about how we see things as doctors and scientists, and how we can learn from people by listening to their stories, and how we can expand our knowledge and maybe ask different questions to really get at the reality of the problem. Today we are joined by 6 of our responders, and I'd like to just introduce you by name now so everyone knows who you are. And we'll start with Christine. We have Rob, Carol, Bill, and Tyree. All of them participated. Oh, I'm sorry. And Glenn.
And Cindy.
And Cindy has joined us too. She's a wife of one of our responders. So all of these responders have participated in the Oral History Project at the World Trade Center Health Program with us. And I've had the privilege of knowing them as people, and as they've helped us really publicize this project, they've been really great in our education initiatives, and some of them I've had the privilege of interviewing. I just want to start off by thanking you for being here. You do so much for us, and I think, to tell your story, to share your story, it takes a lot of guts and a lot of bravery, and I probably say this a lot, but if I were in your position, I don't think I could do what you do, sharing your personal story with others. When we first started thinking about doing this oral history project, it was during a very tumultuous time when the Zadroga bill was not yet passed. There was a lot of real public discussion about whether or not the federal government should pay for health care for the 9/11 responders. And it was constantly on our radar because we worked with responders on a regular basis. So we were really in tune and paying attention to everything and listening to the political arguments. And it was very upsetting at times. You got to see that there was many people in this country that had absolutely no compassion for the responders, that there's a lot of hard-headedness. People really didn't understand what the responders sacrificed and what they went through. And this really got us going and thinking of how can we change this? How can we educate people? We, in our line of work, hear the stories all the time and couldn't imagine how they could not have that compassion that we did. And also to understand what the cost of altruism was, what people gave up when they so willingly went down there to help, and the health issues really that were important looking at. And that really, we really started thinking about how is the best way to do this, and we felt like the responders we should give a voice to the responders, and how can we do that? And that's where the Oral History Project was born.
What year was that, Julie?
That was a year. We thought about it the 2 years before 9/11, but we had to, get permission and get everything set up. So I think we started our first interview in
2 years before 9/11?
Before the 10th anniversary of 9/11. I'm sorry. We started the first interview was it was in May or June of the 2 years before the anniversary.
I see. 2009 or something.
Yes.
I see.
Right. And from the very beginning, we knew. I think Carol was our first interview, right? Yeah. We knew, we were not turning back. We were doing this, and this was where this was so important to document these stories. And we also went from thinking that we were going to do this on our own to thinking we really needed to make sure this archive didn't end up at Stony Brook in Dr. Luff's office, because we needed people to know. So we began a conversation with the Library of Congress at that point to have them help us curate it, so that it would always have a place in the American discussion about 9/11. And we thought about how would be the best way to go about these interviews, because in the end we really wanted it to be the responders' voice. We didn't want our own judgments, our own political views to influence what these interviews were about. We wanted to just be as simple as possible and to just documenting each individual story. And we felt that that was the only way to really have an impact on people, was that it would be raw and be authentic. And that may be difficult. We knew it might be difficult because we didn't want to gloss over anything. We wanted it to be the truth and what people experienced. At this point, I'd like to introduce Amy and have her introduce her first question, because it was a really great question. I think it's a good one to get us talking about these issues.
And if I can just say one thing, so until 2009, nobody else in the country or globally had thought of preparing an oral history.
I don't think that is I think there were other projects. I think there was a project at Columbia. I don't think it was a public project.
I see.
And there was another project with Voices of 9/11 that were collecting stories for the museum, but those were different as well.
I see.
And I think one of the things is we wanted to focus specifically on responders and their families, and that was our focus. It wasn't on just documenting what happened from other observers. And the other difference is that we didn't have a lot of guidelines. Like we weren't going into this expecting to find anything or document anything specific. We went into these interviews with trying to be as open as possible and allowing the responder to lead us through their story. And I think that differentiates us from other projects that were going on at the time.
Okay. So, I mean, all of you are incredibly brave and candid and generous for sharing your stories. I really thank you for that. So my question is, Weisel, a prominent author and Holocaust survivor, strongly encouraged fellow survivors to share their story with this statement. I decided to devote my life to telling the story because I felt that having survived, I owed something to the dead, and anyone who does not remember betrays them again. Do you agree or disagree with this point of view? What does Eli mean when he says anyone who does not remember? To what degree do you think that the process of telling the story is helpful or cathartic for you, and to what degree do you think it possibly reopens old wounds and can possibly renew trauma? What about individuals who prefer not to tell their story? Is there an obligation for people who were involved in 9/11 to tell their story?
That guy was a brave guy, because you can't tell this story, like he told the story a million times. And he did keep it alive, because everybody's dying off from that whole generation. I can sympathize with him, but I don't know, maybe that was a different era, you know, more genteel or something, because it's very hard to tell these stories again and again. I didn't want to do this, but I did it, and I was so glad I did it, because it was very therapeutic. But as for talking about it again and again and again, little blips here and there, I'll say something, because something will remind me of it. But you just, it's not, you know, and the people who don't want to tell it, let them leave them alone, because the stuff that they saw was so bad. I have a friend who drove the mass trauma bus, and she saw everybody jumping, and her partner got killed, and she ran away saying, "Oh my God, I hope the building falls, because America doesn't need to see this." You know, it's bad, these wounds, you know? It's bad. And that man was one of the there are a lot of those guys that still do, some that are alive still do you know, they actually go every day and do the thing in the memorial walls with the Holocaust. They're so brave, those people. Unbelievable. I think it's a whole different generation, that grace generation thing. Different breed.
But Carol, you said something very interesting in the first sentence, which is that you didn't want to do it, but you felt that you had to, or you chose that
Well,
you
my
did.
friends were pushing me into it, and then when I did it,
No.
I felt great after I did it. I was like, wow, I haven't told anybody all that crap.
So
You
just
know?
tell us a little about that struggle.
About doing
Not
it.
wanting to do it and then
Because
coming
you
around.
know what? It's like when you go for the annual appointment and you go see the psychiatrist, they poke you till you cry. And I knew, you know what I mean? It's like, because every time I'm there, they poke me till I cry. And I knew it was going to open up a lot of stuff. You know, I felt a connection to my parents. My parents were both in World War II. My mom was a MASH nurse in Europe. My dad drove landing craft onto the beaches. I felt so connected to them. And they're so much older. I knew it was going to open up. My parents dying. I mean, I could foresee it, just this waterfall of stuff. So, you know, I didn't want to do it. My friends were like, do it. And I was like, all right, I'll do it. And then she was great, because they made an environment that was very open and very friendly and very calm. And then when I went home, I was like, wow, you know, I felt like lighter, you know. But I don't know if I want to do it ever again.
How
I
do you?
can say,
Oh, go ahead.
both
Patty.
my wife and I will both respond to this. I talk about it, she doesn't, she can't. For me, once again, it's been therapeutic, and it's helped me remember things that I've forgotten along the way. The mind is great. It helps protect us and hides things that we really don't need to see. For me, it's refreshing, I guess, because I'm clearing my plate. But it's not about me, it's about those who didn't survive. I'm telling their story. And I don't want people to ever forget. You know, like she said, we all saw some really horrible things, you know, and it's tough. Every one of us here, and we've made a living out of the worst 10 minutes of everybody else's lives, and that takes a part of you.
You see how, like, even when we all start talking about it, you get upset. I don't know how, I watched a couple of shows last week about all these Holocaust people that actually do these tours. How do they do that? Maybe it's repetitiveness or something, but I could never do that on a weekly or a daily or any kind of basis. The moral fortitude of that generation or something has to be a different makeup than us, because we're just so, maybe because we don't have that crap going on. We never saw this kind of crap, you know, I don't know. I have no idea how they got their strength to do that.
I think we all have, as the responders, we have an obligation to keep the memory of 9/11 alive. And America's a great country, and Americans are great people, but we tend to forget. And most people just want to go about their business every day. They go to work in the morning, they come home, they have dinner, they sit on the couch, watch TV, and they do the same thing 5 times a week. It didn't affect, 9/11 didn't affect them, so they forget about it. Whereas we can never forget about it. There's a minute in the day that any of us here don't think about it. It's just embedded in our minds and it'll never go away. But I feel that I have an obligation to, not just to America, to let them know what we went through right from the horse's mouth, because this has never been done before. You know, with all the wars that we've been through, I don't think they ever had some kind of verbal, whatever they call it again. You know what I'm saying? You read about it in the books, but to hear it from the people directly, and it'll be in the archives forever. And, not just for Americans, but for the whole world to know.
So if I can, without interrupting you, this is a very important point that you've made, because the question that Amy talked about is referring to the memory of the Holocaust. And there are some academics who've described that the Holocaust really was not narrated by witnesses of the time, even though Eli Wiesel is a survivor. And for some people, they, in order to survive a horrific experience, they felt compelled never to speak of it. And for others, in order to survive, the only way they could survive was to speak about it. But at the time of that heinous event, there were no disengaged witnesses. And we're going to talk about that, but remember what Glenn said.
I just want to say something real quick. You gotta remember, for the most part, nobody knew that what was going on in those concentration camps until the Americans broke into the prison.
Yes.
And they were like, you gotta see this is,
Yes.
no, my point is just, with the social media and everything else,
Yeah.
somebody would've got wind of that early on in the war,
Yeah.
you know, it might not have went on as long as it did. No one knew until the war was basically over and they were
Yes.
running and we were hitting the camps.
Yes.
So,
So that's exactly, it was an event.
No one
with
knew.
An event with no witness, exactly.
I travel at least once a year to a different state, and this year I'm going to Denver. And when I meet people from out of state, they have no idea like what we all went through, people living so close to it. In the last meeting, very strange questions, but it's like, I didn't want to do the oral history project. I had to do the oral history project because it's so important that you talk and you keep that alive and freshen everybody's memory of what's going on. Like this week I was very affected by the Boston situation. Because I have cops in Boston, I have cops across the country that I'm in touch with the National Women's Association that I'm affiliated with. So talking about this, it's very painful and it's very upsetting. But every day we wake up and we go to the medicine cabinet, we take our medicine because we're all sick. So when you say, how do we forget about it? You don't, because of all of our ailments. We all look pretty healthy, but we're really not on the inside. And a lot of times, you as doctors can't help us because you don't know where to start, or we've never seen this before, and how do we deal with that? And like the 9/11 sarcoidosis. I mean, you all know what sarcoidosis is, but now there's 9/11 sarcoidosis. So how do we treat that? And I can go on and on, but there's a lot of people here.
Don't you wish, I'm asking my responder friend, don't you wish it wasn't a monitoring unit? Don't you wish it was like, hey, let's try and help them, let's do some experimental stuff? Let's
So
throw them in
brilliant.
in one of those chambers, those hyperbaric chambers, let's try some holistic stuff, instead of just throwing medicine at us and watching them die.
That's a really interesting thing you bring up, right?
well, like,
Yeah.
we went through, I know myself and Glenn, I don't know who else, had went and applied for the disability pension from the city. And I was told myself, I have acid reflux, I have the GERD, which caused esophagitis, I have gastritis, asthma, restricted airway disease. I'm going for my second sinus surgery. I'm going for abdominal surgery. I was told that the only thing that they were gonna look at, I needed less than 60% lung capacity. And all they're going by, can I perform my function as a SWAT team officer for the police department? Which I know I can't at this point. I was just told that all I would, the only thing that they're gonna go by is that I needed less than 60% lung capacity, and I was denied. So now, you almost go through all this and you're almost kind of like, I don't know about you, but I was pretty embarrassed. And the board that decided this,
It was horrible.
there was 3 people like 90 years old, and one actually fell asleep in the first 5 minutes of my interview. I get a phone call going home, no, you were denied. I had a list, they said, "Do you want any Medicaid?" They didn't even read from my notes. I retired from the job, was asked to come back. I came back, the doctor for the police department says, listen to my lungs, and he disqualified me from wearing I couldn't do scuba anymore, and I couldn't do hazmat with a tank on. And he disqualified me. So this guy's looking through the paper, he goes, "Oh, it says you were qualified to go back." I says, "No, it says disqualified." "Oh." And in 15 minutes, I got a phone call. They may show you in your car on the way home to tell you, no, you didn't get it. You needed less than 60% lung capacity. That's all this other stuff that I didn't have. I don't smoke. So it's kind of like, this is one of the few places that give a shit, and you feel almost like a scrub. I was embarrassed. I got like 15 medications. And it doesn't matter.
The same doctor is in that unit that when I was a rookie, was old when I was a rookie, and now they're ancient. They actually had, when they were listening to my lungs, 3 of them put on, they were like, "I think I hear a wheeze, Harry. I think, come here, Harry."
No, they were literally, you talk about.
And then the French lady, "I hear pussycats in those lungs."
No, but literally the guy, this is like a couple of minutes into it, I look over and I'm hearing snoring, I'm like, I look the other two, am I holding this guy up? And then you get a phone call 15, they make sure you're in your car and you left, you signed out. They don't want to tell you there. I don't know what happened to you, but that's what happened to me. I have to go again, I have one more sinus surgery, I have to go back because it's causing migraines. I have to go back for another sinus surgery and abdominal surgery from the excessive coughing. I believe that my stomach wall is weakening. And I'm almost embarrassed to the point where I have to wait for these other 2 surgeries to complete my case again.
Bill, when you keep referring to the fact that you feel embarrassed, what do you mean?
Because they dismissed it. They dismissed it in 15 minutes.
But you're embarrassed on their behalf? On your
I was
own
embarrassed
behalf.
to even try. They give you 3 chances to go back. They dismissed it so quick.
See, the problem is the police department sends you to the doctors they want to go to, so they're like all in cahoots and they hang out together. So it's like, it's called denied, deferred, or you're out.
Yeah.
I
It's
consider
just a very, very poor system. And I was in the medical division after 9/11. They put me in the medical division when I was injured, so I got to see all the inside stuff that was going on.
I see.
So the sick cops would come to me, and I'd be like, "Don't go to that doctor, go to this doctor. This doctor's gonna help you with your lungs. This doctor's gonna help you with that." So I was able, my role after 9/11 helped me because I was able to help a whole bunch of other cops get to where they needed to be to get physical and mental health.
So you became their advocate.
I was an inside person, and I became an advocate, and I became friends with 3 of the doctors that I was working with and for with the police department that I didn't feel were idiots. They were very fair to the sick people. But as they're saying, these other people that are behind the board, Slim must be 102 years old, the guy.
And you know what,
Well, hold on one second, Bill, because I want to see if the students are hearing what Bill is telling you. So what is he describing? Not the details of his story, but when he says, they didn't even read my notes, I'm on 15 medicines, they didn't leave, I'm in my car driving home. So what is if Bill was your patient, what is he saying about the physician? Or anyone? Yeah.
I think you could say that they're dismissing dismissive of your suffering.
Di-
Yes.
Dismissive is what the big word, but what more basic than even that?
They don't care, they don't give a shit.
More basic than even that.
They're not listening.
They're not listening, and that's the whole purpose of narrative, is that the whole purpose, I think, of if we go into medicine, is there are going to be so many things that you can't fix or have their own course, but that you are going to be a companion and you're going to accompany the patient on their suffering and hopefully alleviate it, maybe cure it, but certainly not add to it. And when somebody is not listened to, that's what it sounds like from the patients. What Bill, when if he was my patient, that's what the patient is describing, and that's where the oral history might have a therapeutic benefit, even though it's horrible to talk about those things. If somebody's listening, and somebody said you created a safe and nice environment and so on.
Our point of view is we didn't ask any questions when we went in there. We knew, we knew it was a fucked up situation. And we went in anyway, and have your own department. I mean, I was shocked when I went back to work 3 days later. It's not, you're not talking about a bunch of crybabies here, I'm not asking for anything I don't feel I deserve, but I'm really limited. I'm stretching just to pay bills to go work 2 days a week. And it's a lot. If I really didn't have to pay the bills, I wouldn't even be doing it. If I could just kind of take care of myself.
I think there's catharsis and then there's validation following catharsis. And when there's catharsis and no validation, I think it adds to the injury.
Well, police officers just don't go ask for help. I know I never asked anybody for help. I was medicating myself through over-the-counter stuff like that, till I became so sick that in front of my friends, I was a private investigator, I retired. I came home from work and I collapsed, and my friends had to take me to the hospital, and then I was in the hospital for forever. They didn't know what was wrong, but I was not going to give in. Cops are like, okay, I'm good, I'm good. It's just this. And then when you do finally go to somebody and say, I'm not so good, and for them to shoot you down, it's horrible. It's just,
Or as Bill said, he wasn't allowed to ask any questions.
Yeah,
To me, that sounds like...
If you knew this guy, I work with this guy. This guy is the guy, oh, you got somebody up on top of the bridge, hang on a minute, boom, 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 I'm up there. This is a guy that's insane. Bodybuilding.
Thank you,
I've got a guy on the roof with a rifle shooting at me, and this happened. And you call Billy. Billy comes up and he goes, "What do you got?" Of course, I go, "This guy's shooting at me." He goes, "Bang!" This guy is so take care of business, and for him to go ask for help, I can't even imagine. And for him to get shot down, I can't even imagine what that car ride home was.
And to piggyback on her, and Glenn as well, a lot of you have no idea what the ESU cops do, okay? You guys get in trouble, you call 911. When the cops are in trouble,
We call that.
they're calling the ESU.
And Billy.
They're the problem solvers, they're the supermen. They've got the answers for everything. And they're the guys who, pull rabbits out of a hat when the shit goes really, really bad. And just like she said, these guys, looking back on that day when you saw these guys and the guys from the rescue companies in the fire department crying,
Yeah.
it was really, really bad.
Yep.
When you talk about the police department with PTSD or any type of psychological problems, when I say I was there like 3 minutes after the first plane hit, I was there like a block away, so how long it took me to run up that block. It was almost 2 years before they forced me to go to a psychological evaluation, where they had a group of people and officers that were responders, and everybody was required to go. But it took them almost 2 years. And I told the sergeant, I go, I'm not going that.
That's to cover your ass in case you
I
shot
know.
someone. Did anybody talk to them?
Absolutely.
Maybe it's due to 9/11.
Absolutely. I'm like, yeah. So then when the police academy and they're asking you all these questions and everything, and I said I had nothing to say. I really didn't have anything to say. It took you 2 years to get to me,
Plus, if you check too many of these boxes, you'll have no gun.
Yeah, and that's another thing. The police officers.
So we were all fine.
I was afraid of the rubber
Yeah, we
gun
know what the
squad.
deal
You don't
is.
want to be in the rubber gun squad. A lot of people don't want to do that. Give up their
Go from a
guns.
SWAT team
Well,
to paint barriers.
9/11
That's what
happened on Tuesday. On Friday in 113, a female sergeant was shot in the head and killed. They called us all in off patrol, and we're like, oh my God, what happened now? Oh my God, what happened now? You know, they call us in, and they got all these counselors there, and they tell us about our colleague getting shot in the head, and they go, we're sending you all home for 12, we're gonna figure it out, 12 or 16 hours. We don't know, these are counselors there, we have no idea what to say to you right now. We haven't got a clue, because this is on top of everything else you're going through. And these guys actually said, maybe before you go home, guys, hit a bar and have some drinks.
Unwind, go on.
They were overwhelmed. The counselors were overwhelmed. They didn't know how to break it to us, how to tell us, and then they said, you know, we just, because we had worked, you know, for like 3 days, go home.
I have a question. So I completely understand why you would want to check, you know, that you're having any sort of issues because you don't want your gun taken away. But then I also understand the other side of it, which I'm sure you do too, of, you know, if you see someone that's having issues, you probably don't want them to have them, you know, maybe, right? It's personal, it's case by case. You can't, it's hard to just look at a form and be like, oh, they checked 5 things, take their gun away. You know, you have to really talk to the person. Are they, yes, they're going through these things, but they could still be mentally stable. What would you propose about that?
The
Like,
police
what would you
department
change?
is all about covering their ass. I mean, listen, I love the department.
Yeah.
I can't say anything bad about it, but it is dysfunctional in some aspects. It's about covering your ass. Anybody who checks, I'm not feeling good. My interview after my last shooting was, it was about, you've been on it too, what was it, about 20 minutes? How you feeling? You know what to tell them. I feel fine. No, I'm really looking to go to lunch, and you know, the guy shot me. I shot him back. He didn't make it, you know, and you know, I'm good. And okay, well, that seemed fine. You can go back to work full day. Let me tell you something. You circle a 2 or a 4, whatever it is that's going to knock you out of the box. You'll be unmodified. We're just going to hold on to that. Do you have any other guns at home? You'll have a sergeant go to your house, take your off-duty gun, and it will take you, and no one is going to be the one to say, listen, I say he's fine. No one's going to do that, because if you
Once
have
you
a
get to that
defective
point,
machine
the police
moment,
department, you don't.
and God forbid, something happens, you get another shooting, you're going to be questioned. Who gave this gun back? Oh, so you're almost, I mean, you're just ostracized. So you can't say anything. Not while you're still on. Retired, I don't give a shit now. I'll tell them whatever I want.
Well, what would you suggest? Or is there, and also is there?
If you had real counsels, like what I went through and Glenn went through with the medical board, Glenn's been denied too for the same crap. And,
But I'm getting social security disability.
So the feds say you're okay, but the city says you're not.
The feds say that they acknowledge my illness from 9/11, but the police department has denied me 6 or 7 times already. So how can you be deemed disabled by one agency and not another?
right, that's the problem.
Gosh, that's a
And like Julie
strange
said,
thing.
they thumb through your notes. I mean, you can have a medical portfolio bigger than this, and they go like this in front of you.
Is it doctors that are doing this? Or
Yeah,
these
but
are
like,
policemen
let's
that are
say
doing
they're
this?
doctors, but let's say you go before the board, there's 3 doctors, you have to sit down.
And are they also police officers? They have a police
No.
uniform?
No,
They're just-
they have the rank of inspector, police inspector. They're never police officers, it's just the courtesy they get
I
for
see.
being a police surgeon. But you sit down before the medical board, if you're going for, let's say, respiratory, only one of them has to be
Pulmonologist.
pulmonologist. The other one could be a chiropractor or a
Could be
gynecologist.
anything.
They're nutrition, we have a nutritionist there.
Yeah, that happens.
And
It's really a joke.
And it sounds to
Joe's
me
involved.
that the
Yeah,
decision could be just as simple as you have one measurement, and if you don't meet that criteria, that's
Yes,
it. It doesn't
that's
matter,
what-
the rest of your
right.
story, the rest of the things you're
I
undergoing
think
doesn't
what it comes down
matter. It just
to-
has to fit in the box.
Besides that is they were told by somebody above, probably in the mayor's office, that, you know, if you give it
You'll
out to
open the
liberally,
floodgates.
you can open the floodgates and everybody's gonna think they're entitled to it, and it comes down to money.
So there's political factors as well.
Absolutely. The police department is 100% political.
You guys have heard me say this before. The city, the state, and the federal government has a long-standing history of fucking everybody. Responders. And I'm sorry, I'm being a little abrupt. February 27th, 1975, New York City, they had a telephone company fire. When I became a volunteer firefighter in 1982, they found out that every single firefighter that was at that scene had cancer.
PCBs.
Yeah.
Yep.
They found out by 1985 that every firefighter that was in the building was dead from cancer. And those,
Oh my goodness.
okay? to this day, there's, I think, one, possibly two survivors. One of them's John Vigiano. Lost the better part of his throat. Other than that, and the city still, to this day, there's no correlation. Let's look at the Agent Orange veterans from Vietnam. They're just turning around now, and they're saying, hey, these guys have real issues.
Most of them are gone now.
Right, 40 years later now, they're granting the survivors, you know, full disability. But you had guys in the same boat 5, 10 years later that have been fighting, and they're long gone. And a lot of it's political because they're afraid that, well, how are we gonna pay for this? But it's okay to pay more, you know, baby mama drama, you know, hey, the welfare recipients, you know, let's just get out of jail, you get a free house now. And it just, we wanna give everything away, but we don't wanna give those who paid their due. I have a big problem with that. I have a huge problem with that.
Your question, to answer your question, what to do, they have to have somebody outside of the police department that, totally outside of the police department, that, you know, it's not like the police department's gonna say, I'm gonna send you there. Let that individual person pick somebody to go to and get evaluated. Here's what you need to be evaluated on, bring that to the doctor, you need to evaluate me on this. And at least I feel that would be a better shake for everybody else than what happens.
They're attached to the police department, you have an independent board, say like Mount Sinai, you know, or whatever. We're all going in there with medical folders like this. We didn't have a folder before 9/11. I didn't have a folder. I went to a walk-in once a year maybe for a cold. You know,
we gotta take an OSHA medical every year in the ESU.
Yeah.
And Billy will tell you, we're all in, you have to really be in good health to be in emergency service, because like Billy was saying before, we're all trained scuba divers, so.
hazmat.
Hazardous materials, we wear sky packs, respirators and stuff like that. And when we do tactical jobs, sometimes we might have to go in with gas mask on, throw tear gas and stuff like that. So we're scrutinized as far as that goes. And again, that's because the city wants to cover its butt. They want to make sure we're in good health to do the job that we need to do. So,
And even after they disqualified me, they still told me no. You disqualified me. You're the one that told me my lungs were fucked up years ago.
we never had.
I got referred by our doctor, Romanelli, from the department. Did you ever hear about the Mount Sinai project? That's who sent me here. Their doctor disqualified me, sent me here. Now I have a folder like this, and the same department told me no, there's nothing wrong. Okay?
Which is it?
So how does that even, you know what I mean?
I think one of the ways to change it is to get a lawyer who's got a set of balls to go up against them, because they're really disobeying the law. Because everything regarding 9/11 with the police department is based on the presumption bill. For those of you who don't know what that is, Governor Pataki signed a bill back in 2005 that has a list of medical conditions on it. And if you have any one of those medical conditions, it's automatically presumed that you got it from working down at Ground Zero. And you're entitled to change your pension from a service pension to a disability pension, which is a big difference. We're talking about half pay taxed to 3/4 pay untaxed. And
So this presumption bill, if
presumption bill-
illnesses are not on that list, that doesn't count? Is that what you're saying?
yeah, it has to be on the list. There's probably 15 different illnesses on that
But
list.
they do what they want.
And they don't update it with any new knowledge?
The presumption bill specifically says that,
Yours are on the
Yes.
list, and look what they did to you.
it says that if you have the illness, it's presumed that you got it from working at Ground Zero, and it's not up to a police officer to prove that you got sick from 9/11. If you have one of these illnesses, it's the doctor's job to disprove it, and they totally disregard that and they get away with it.
Oh, my goodness.
They're not even following the law.
Have to fight.
They fall asleep.
Still he can.
They fall asleep listening
He's
to
on the
you.
list, why
I
still?
went-
With a medical folder, I shit you
I
not.
went
This
in
big.
front of the board
All kinds of
2
experts.
times, got denied. The third time I went, I just happened to be really sick. Like I had bronchitis, I had a sinus infection, and I said, I'm dragging my ass there because I'm not putting this off. I went there, I was so sick that somebody, like one of the people that worked there, saw me in the waiting room. They said, you better take her because she doesn't look good. And then they asked me if I wanted to go to the hospital. I went in there and they gave it to me. But I think it was because that particular day, I was so overwhelmingly
Well, what did
sick.
it say in your papers when you,
But I fit all the criteria. I had the lung,
I know,
you know,
what does it say? You know,
it said that I it was a
Was it
9/11.
for sinus, was it for
Lung
lungs?
capacity, 9/11,
Less than 60%.
yeah.
That's because
Right.
mine's not less than 60%.
One of the
All
female
other stuff
officers-
doesn't matter.
One of the female officers my wife worked with, turned out she's got sarcoidosis. And it was diagnosed through Mount Sinai, through you folks. I mean, once again, now she goes to the department surgeon, and finally he turns around and says, look, knock it off, get back to work, I'm gonna put you off the job, and we'll take your guns.
In other words, make you retire as a malingerer.
You know, it's a well-documented, she's retired now, and now she's gonna fight for her 3/4. She says, you know what, screw them, I'll get out, I'll get my half pension, they can't take that from me, and I'll fight them for the 3/4, which will probably take her another 10 years, and they're gonna hope that she dies before then.
Glenn, how many people have passed away, do you know, from 9/11 illnesses, first responders?
First responders that we know of, over 1,300 to this day. Over 500 with cancer that we know of also, and I say that we know of because there were responders that came from
Now, there was only
every
10,000
state in the country.
There was only 10,000 first responders, 1,300 from illnesses. And the rest of it like, listen, can you just help me get by? It's really hard for me to get to work right now. Can you just help me out and supplement my income? Because sometimes I feel like I can't make it into work, my big 2-day-a-week job. I mean, that you're not asking for the moon.
How many guys retired when they were
1,300 out of 10,000 are
You
gone.
see, that figure is
500 have
that's
cancer.
completely unknown. That figure is completely unknown.
Well, Glenn knows, because he's
No,
an
no, I know
advocate
you
for the
know.
field.
You are
group.
experts in this, but what I realize is that for this country, they think only of the deceased who died in the moment of the attacks
Yeah.
that are commemorated.
Separate.
And
Yes.
I was thinking about this week because the events in Boston are so depressing, but they also reminded me of events in London in which I was involved. But I thought the only time this country thinks about first responders is when you see all the yellow coats and red hats and ambulances in this kind of scene. And then after these scenes have finished, the country doesn't remember, and nobody would believe there have been almost half the number of first responders died as a complication of diseases as died in the attack. So they are not visible or heard from.
So one
That's
out-
why I think the Oral History Project is so important.
1 out of 10 of us are dead already, that went in there.
Yeah.
1 out of every 10
But-
guys that made it past that and were in rescue operations are dead.
But all of you, your observations are so important, but I think that really fits into Amy's second question. I think this is what we're coming to. Do you want to pose it?
Sure. So one of the themes that has arisen from numerous testimonies from first responders and citizens that were involved is that they sometimes felt a lack of support in a time of personal need. Quote from Philip's story: "There was all this stuff that was available that we weren't aware of. It was very upsetting. Here we were killing ourselves and we weren't privy to any of this stuff. I don't think anybody deliberately didn't want us to know, but nobody had the mindset, we need to take care of these guys, we need to make sure we're okay." Do you think that this sense of a lack of support contributed to your state of physical and mental health? Do you think that improved support systems would be beneficial for first responders? Or is dealing with these situations just part of the job? How would you improve support for first responders and ancillary workers while they're dealing with a traumatic event like 9/11?
So I think this is the central question. While you were speaking, I was thinking, do you think that this lack of support has contributed to your physical and mental health today, then, in the past? I think that's a central question that you're asking. I thought it was a very good question.
I want to say yes.
Mentally, it pisses
So-
me off. I feel like I got support through the program.
This program.
These people, I mean, Dr. Loft and everybody involved will do whatever it takes to get us taken care of, health-wise. Well, I have been, thank God, to specialists from the surgeries that I've had and that I'm gonna go for, and that's really pushed through the program. If it was up to our benefits as a New York City detective, with GHI, I wouldn't have any of the medicines I have. And I don't know where I'd be. I couldn't afford the surgeons
Wouldn't be
that
able to
I'm going
afford
to
it.
now.
Yeah.
I wouldn't be able to afford like real doctors.
Well, the medicines.
The
You know,
medicine-
GHI, it's like nobody even takes that crap. It's like, yeah, I have insurance, but not really. I mean, anything that I've done, I never went to my own doctors. I went through the Trade Center program. What they do is amazing. but mentally, through what was done to our department, not the program, being so dismissive and not really
And
care.
the federal government.
Yeah, well, now they're already, Glenn, you know, they're already taking money back, and honestly, you know, it was funny, say what you want about, like Wiener.
What do you mean?
When
We
he
don't-
was
we
in
don't-
Congress, he embarrassed them. He embarrassed them into
Yeah,
passing it
right.
for us. You could tell, they were looking to pull the plug. That guy stood up and basically he pointed his finger at them and it just embarrassed them into voting. How could you, just right at them? I mean, I commend him for that, because I think that was,
So
that was huge.
he was instrumental in passing the Sedona bill?
yeah, absolutely. I watched him on TV, I'm like, look at them. And you could see their faces as he was talking, he was embarrassing. You're on national TV, go ahead, tell everybody you're gonna say no.
So that kind of support was only very few people were supporting you, is that what you're saying?
Well, they were looking, hoping it was gonna fade away and
So there
wouldn't
was
cost anybody anything.
So
So
that-
I have a
They want us to
question
die as big as we
regarding
can.
one of Amy's points she was making in this question, and I know a lot of you are involved with the New York Police Department here, but you know, there were a lot of responders obviously from all over the place, and sometimes I think because you came from first responders who have a structure in place, that you would have more resources than volunteers. I mean, there's many other people there, and I think the person that's being quoted in her question worked for the city just as a building inspector, and felt very isolated, even maybe more isolated, because even at 9/11 on the pile, he didn't know that there was food available if he needed to take a break, or he didn't know he could get a change of boots. Like, he was unaware of the resources there, and then now, even later on, had maybe even less resources, and, you know, maybe we can bring that into the discussion
Well,
too.
Right from the get-go, I don't know how old you guys were during this, but we remember 3 days after it, Christy Todd Whitman from the EPA. The air is safe, it's okay to return to the area. Well, we're finding out now, clearly that was not the case. So, support from days immediately after was, you know,
So you're talking about political support was lacking, but also support within your own professional community was lacking?
absolutely.
And now
don't-
public support is lacking because people and when you go to state, they don't know anything about it, you're describing.
They don't realize what we're going through. They think that like all our medicine is paid for, all our healthcare is paid for, everything's taken care of. I'm like, no, I said, this Droga Act was passed, and they're doing the best they can, and the clinic I go to is wonderful. They push for us to get everything we possibly need, but they have a guideline that they have to follow so that they can help with what it seems like a lot of money, but it's really not, because there's so many people involved, and they're not aware of this. They're like, oh, we thought you get everything, we thought you were fine. I'm
I
like,
don't think
no,
the police department did anything for us.
they didn't.
The Feel Good Foundation did a lot for us, but the police
Yes.
department did. I never got a call from the police department, hey, we just heard you got 3 calls from, you need anything? Never. You never really saw Patty Lynch down there fighting when we were down in Washington DC fighting that stuff.
Who's
I don't
that?
think the police department did anything. So
Patty
don't
Lynch
feel
is
left
the
out if you work in
president
an
of
office
the
building.
PBA.
I think Rob had his hand up.
Yeah.
Did you hear from
Say,
him?
I'm not with the police department, I was a volunteer firefighter, okay, so my perspective is a little different. So what happened was, everything happened on a Tuesday, I got home on Wednesday, I was at my firehouse on Thursday, they brought me to the hospital. I was in the hospital on Thursday, got out Thursday night. One of the things they did before they let me out of the hospital was they actually called the government, the EPA, and said, what's the story? And they said, yeah, the air quality's fine, you have nothing to worry about. Because even Huntington Hospital was concerned about asbestos. And they directly asked, and their direct answer was, no, the air quality is fine, it's safe.
Everything in this room
Wait, excuse
is
me,
in our lungs.
was that a doctor who phoned
Yeah.
to find out about the air quality? Your doctor in the hospital?
From the hospital, yeah.
And once again, there's a long-standing history within our country, even now with our veterans coming home all broken up, not whole. Yes, the VA's gotten better, but once again, it's because of advocacy groups like the Wounded Warrior Project that these are guys are getting what what they deserve. Because of groups like the Feel Good Foundation, that have sat there and really, been a pain in the ass to the politicians and you know, John,
Because the Droga Act
is in
wouldn't have been
everybody's
passed
face.
if it wasn't for the Fielding Foundation.
So this Fielding Foundation is run by police officers, right?
No,
No.
no.
John,
No, John
Glenn,
is a
I'm
I'm the
construction
vice
worker.
president.
Okay, so it's first responders, these are just people who are there.
John
John-
Field, that's
Yeah.
why it's named called
Yeah,
Field.
right, that is.
John Field was a demolition supervisor,
Okay.
and on, it was September 17th, he was backing up a truck with steel on it, and a piece of steel fell off, landed on his foot. He had 32 surgeries and lost half his foot. And I guess he channeled his energy into starting Fielding Foundation. And we've been instrumental in getting this Droga bill passed. It's between us and all the members of the Fielding Foundation. We've been to Washington, D.C. well over 100 times. In fact, John's leaving tonight. I can't go because I have my colonoscopy and endoscopy on Friday. But we walked the halls of Congress for years.
It sounds to me, to respond to some of Amy's questions, that you really need to get one of your own into these political positions to advocate for you, someone who, you know, within the system.
Well, we've had
No,
people-
I'm not being, trying to be critical, I'm trying to say, like, and everyone sitting here, to try to validate, I mean, I'm a big fan of Elie Wiesel, and that by telling your stories, all of us are hearing that, we're bearing witness, and then someday when we're gonna be doctors, we're not gonna forget this, you know. As you guys get older, we're gonna remember your stories, and then
You'll be taking
we're
care
gonna be
of
in that
us.
system.
You'll be taking care of
We're
us.
gonna be within the system.
I know that old
That's
wasn't.
the goal. I mean, right? That's the goal of this class here, is that we're gonna hear you, and I can speak for everyone, like, we will remember this.
And I also
So hold on one second, because what you said was important. You began by saying, what I'm hearing from you is you need an advocate in a political position, but you concluded by saying that the physician needs to become the advocate
Yes.
for his
The
patient.
advocate as well,
That's
yeah.
that's the power of narrative. And I just was walking to this room from somewhere else, and I saw this room, which every American hospital has, and probably Britain has too, the Patient Advocacy Center. And the patient advocate, can I tell you, as a physician, that phrase makes me so angry.
That you would need
because
it.
that it is needed, that I never signed up to become an adversary for my patients. But the experiences that we're hearing today are where physicians have failed their role as physicians. It doesn't matter if you're appointed as a board or you are in a clinic for unfunded people or what setting you're in. If you are not there for your patient, you have failed the profession. So because you are going to have this field of narrative medicine, which I didn't have, and there were many physicians who lived through the Holocaust and have their stories, and some of the physicians who've trained me were born in displacement camps. They didn't have these contemporaries. You are the physician contemporaries of this event that other events have not had. You don't need to become politically empowered in order to effect change in the way we think of conventional political office.
Right. If we
That's
had
what
advocates,
that's what they've missed.
that would be great. If we ever had advocates, even from the program, and go, listen, like, go down to the police department, go down with your phone, listen, enough of this bullshit. I'm gonna sit on this, and I'm gonna tell you, knock your crap off. If you have this many illnesses listed, what are you doing to this guy? First of all, there's not that many of us.
Yes. And also this part that's so sad is that someone has a major file and you know they haven't read it. That makes me most sad of all, actually.
Yeah,
So
they
there's
did one of these.
that means there's no regard.
Okay.
What do we do when we meet a patient? We take a history. What is a history?
Patient history is
A
so
story. The story.
It would be unacceptable for any doctor to treat you that way.
But just to finish the point, Michael,
Yeah.
the story needs, narrative means story. There can be no story without a teller, and there is no story without a listener. So we had all these tellers, but we had no listeners. So we are lucky that we have a decade after the event, you have listeners in the Oral History Project.
Thank God.
With the Holocaust, it didn't really happen in the literature for 4 or 5 decades. There's a lot of reasons why, but these kinds of this work and opportunity that you have as physicians to be, other physicians have not really had in as far as I know in my reading. So it's not just they can tell the story, But if we're not listening, the story isn't really a narrative.
I think you're letting people of my parents' generation off the hook a little bit. Because personally, I'm looking at that. I know I grew up, my grandparents were Holocaust survivors, so my parents aren't doctors. But if they were, they grew up listening to their parents and their parents' friends tell these stories. And
Yes.
listening to these stories and being told, like, this is important for you to remember because I'm not going to be here
Yes,
always.
that's true.
You need to remember. So I think my parents' generation grew up with these stories of World War II and trying to remember what World War was like, because I never experienced that clearly. So I mean, I think bearing witness and listening to these stories and
Yes.
remaining an advocate is not something new.
You know what, even
I-
if
There's
you
an
went
opportunity
down.
for a call to action, though.
Sure it is,
Christian.
absolutely. Yeah.
Even if you went down and pleaded your case, like all these other people were like going down to get your disability, if you're having trouble towing
But
the
even
road at
the-
this point, even if you lost, to have somebody from the Trade Center come down, if they had a pool of people like that, go down with you with your phone and go, all right, I want valid reasons why.
Yeah, but
Put
even,
them on the hot seat and really make them explain,
but
not
even
fall
the,
asleep
yeah.
at the table.
Even the language Bill uses, Bill says, pleading your case, meaning pleading my case,
That's
as
what
if
it
he
seems- that's
is
what
a
it is.
defendant and this is a
Well-
jury.
Which is something we'll get into next week a lot, because that is what happened with the VCF, right? We have lawyers who basically plead your case for compensation under
Give me
the
his
Secure
number,
Worker.
because I'm taking him with me next time.
Well, when you call
Not for
before the
disability,
court,
but for
you're saying that there's
compensation.
advocates, you have a sergeant, a detective, and a lieutenant that you're supposed to be able to go to and give your information, and they're supposed to be supportive of you before you go before this board of 3 people that fall asleep, and that,
They
you
all
know,
work
Right.
together.
they all
In the
work
same
together,
office.
they go out together, they
They're all in
hang
the same
together, they have
office.
drinks, so
Right.
it doesn't help us all.
I'll take care of
My
it, don't
ca-
worry.
My
You get
case
it?
is totally different. I got out a 3/4 disability for my orthopedic injuries from 9/11, but now I have all the other, I have the lung disease, I have the GERD, I have the 9/11 sarcoidosis, I have fibromyalgia, and we could go on and on. I got the sinus problems. So now my problem is I need Glenn to see if he's gonna be able to help me, to put me on that list. To, you know, when I pass away from all these things that I have, they're gonna say, oh, it wasn't 9/11 related, she got out on 3/4. I'm not gonna die of an orthopedic injury at this point in time, but I am gonna die from what I have in my lungs, from what I have in my sinuses, and from all the other ailments that I have. So I have that problem, I have a reverse problem here. How are you gonna help make that statistic? I'm gonna just be over here, you're not gonna even know about it.
I want to have Mike transition us to we're going to jump ahead a little bit to his question about the physician and bearing witness.
Okay.
Um,
Which question is that?
It's question 4.
4?
Mhm.
Alright. Like V? Yeah.
Yes.
Alright. As physicians, we are trained to listen critically to our patients and use broad, open-ended questions to elicit necessary information. Last week, Sri encouraged us to always be collected. This is a concept that I believe would serve us well both as physicians and in this class about the response to 9/11. We have an opportunity to collect stories from the first responders to the disaster and the physicians who have worked closely with them in the following decade. What is our responsibility to bear witness to these stories? Often we must take time to critically analyze what we are hearing both in the patient interview and when learning from first responders. How can, tying in the social media aspect of this class, how can Twitter and other social media be used to accomplish this goal? Could social media possibly impede our ability to do this? So basically, just saying, this is more for the students in the class. What's our responsibility following this class in the coming weeks, months, years for our careers?
Or you asked an even more fundamental question, which is the responsibility to bear witness. I think, why don't we hear from this end of the group? Is you, anybody?
Sorry, can you just repeat the question?
Yeah, I mean, so we have a great opportunity here where we're learning from all these great people who were there. What's our responsibility following this class?
I think, you know, on a personal sense, that in every interaction that we can make with a patient is to really see where, you know, these brave people have been failed by their physicians, you know. The 90-year-old physician who fell asleep while reviewing, you know, a case and making a decision that can potentially save, you know, and really alter the quality of life for someone, it's just inexcusable. So for me, I can think, and it's hard to do this on, with every patient, but you have to constantly remind yourself that this is what we're here to do, and we signed up to give everyone the attention that they deserve, especially these people. So.
I think it's a baseline necessity to bear witness, and then if you can do anything else, like help their pulmonary function or help them sleep better, then that's great. But I think at the very basic level, you can always help by doing that.
I think that's what we've been hearing, is that even just having somebody hear their story and remember it seems to be a first step.
I had a conversation with Dr. Ahmed half hour before the session, and one of the things we were talking about was how much time a physician actually spends with their patient. She said 6 minutes. I would have guessed about 5.
That's not what I do, that's the average.
No,
So noted. I'm not going to. This
No,
is
no,
a
it's
conversation
okay.
that I had with my doctor, with my grandfather had become a patient. My grandfather was in the medical field. And he's like, nobody treats a patient like a person anymore. The tech comes in, takes vitals, they leave. The doctor comes in, they leave. And they're not doctors anymore. It's just like, an assembly line, from one room to the next. That's not your fault, unfortunately. That's the way medicine has been, because it's driven by the insurance companies.
Yeah.
It's almost everything is being made with pensions is a business decision. Everything's become big business.
I would argue the entire culture has been broken down into these small, bite-sized sound bits, and
Absolutely.
With Twitter, which we've been using, is to try to make everything just get out as many points as you can. Medicine, I feel like, has to be going the opposite direction, and they've been, teaching us and lecturing us that you need to start focusing more on the physical and history again, and taking more time with your patients, while everything else
Yes.
is getting shorter and quicker.
They have come out with this thing which is now de rigueur, which is called patient-centered education. And I'm thinking, when was medicine not patient-centered? But this fragmentation that you're describing is one of the goals that narrative medicine has to overcome, because the fragmentation has resulted in those that practice medicine for business and economic pressures. It has also resulted because the business models of medicine have precipitated very subspecialized 10 subspecialties, so that each patient has 5 or 6 doctors, none of whom talk to each other. And then also that fragmentation separates not just the patient and the patient and the doctor, but also the doctor from the fellow and the medical resident and the student, because nobody is engaged in the process long enough. This kind of time with medical students and with colleagues who are patients of other colleagues is an incredible luxury. It's a luxury that I had to justify because of the pressures that I'm supposed to be under, and fortunately I have the opportunity. But that's what has been lost. And the power of hearing a patient's story, you're never going to hear anyone's story in one meeting. That's why if you're a good doctor, your patients will come back and you'll have more and more pieces to put together. And that then has an effect not just on you making a more accurate diagnosis and the patient getting better treatment, but you start to become invested in your patients in a way that you're not invested if you're only seeing them and not really caring about the story or even listening to the story. Most of our environment of medicine does not invite the telling of stories or the listening of stories. And one of the best fragments I ever heard was from a journalism colleague in a journalism meeting. She says, when I go and see my primary care doctor, I almost feel like I have to go and pitch a story like I do to the editor. The editor has usually about 15 seconds of attention to decide if they even want to know more about the story or not. That's how my journalism friend feels when she goes to doctor. So that's where narrative medicine could change that.
I want to also bring up another side of this. So we've been talking a lot about the patient's narrative and what the patient brings to that narrative. But I think it's also important when you're listening to someone's story to realize we don't listen in a vacuum, and that we as listeners bring to the story our own history, our own interpretation, and in some cases our own worldview that may conflict with what the person in front of us is telling us, whether it's political views or whatever prejudices we hold as individuals based on our upbringing. And the challenge for us is to sit back and actually listen. I think it's easy to talk about listening, but it's very hard to listen. And it takes a lot of training, and it takes even assessment of yourself and what you, where you're uncomfortable, things you're uncomfortable with. And I think about some oral history projects that have been happening in the world of medicine to help destigmatize certain health conditions, whether it's sexually transmitted illnesses, alcoholism, schizophrenia. There's a lot of use for narrative in helping not only the public, but people who care for these people really sit back and see them as people with conditions, rather than something's wrong with these people, or we don't agree with their lifestyle, or they put themselves at a certain age or something. And then to reserve our own judgment. And I'd like to transition here and have Dr. Edmond to read from her book. I think she brings to this class a unique perspective. Many of you have read her op-ed prior to coming to this class, and we can discuss that as well in your questions. But being a female doctor in a Muslim world, being in New York, afterwards caring for 9/11 responders really gives her a unique perspective that I think she can share with us, and how she's dealt with her own conflicts from who she is and who she's caring for, the story she's here, the environment she has been in. And I think we have something to learn from you and your perspective.
Okay. Thank you. To give you a little context, which Julie so nicely provided, part of my practice was in Saudi Arabia, and it was in Saudi Arabia from where I saw the attacks on September 11th. And my training, all of my medical training after medical school came from New York City. And I was working with other doctors who trained like me at New York City, some of whom had trained at Stony Brook. So now is the part I'm going to read is about a day after the events have happened. So, in a crucible of silence, punctuated only by mechanized breaths of the patients around me, I condensed my searing anxieties. Distracted, I studied colleagues through plate glass as I examined my patients. No one approached me to express concern about New York, even though it was the place I still called home. As I ventured beyond my ruminations, I was increasingly aware of excitement. Inside the hermetic world of the ICU, I detected the unmistakable fetor of relish in the face of destruction. I watched through the glass. Majid studied an X-ray, his ivory brow furrowed in concentration. His fair-veined skin glowed blue-white against the light box. An Omani national and a brilliant US-educated physician who had published in the best American journals of medicine, he was a valued, experienced colleague. This morning, his cool blue eyes glinted with an unusual energy. Normally a man of little emotion, he was clearly excited. I didn't dare ask him why, remembering his staggering outburst at my Polish colleagues months earlier, contesting the realities of the Shoah. We had looked at each other in disbelief, especially amazed. Majid was a self-confessed Holocaust denier. I had witnessed his indignant nihilism about the 6 million condemned to be extinguished in countless narrow minds like his. Despite his intelligence, he possessed capacities I had never encountered. Another colleague who's like me trained in New York City said, "These are terrible times for America. Dark days have arrived for that country." I scrutinized his expression, unsure if he felt compassion. Before I could decide, Imran, another colleague, clarified any doubts I might have. "So, they lost thousands of Americans. They're guessing 3,000 right now. Do you have any idea how many people die in Palestine every day, Kanta? The loss of these lives is hardly equal to the daily losses of life in the Muslim world in past years. Don't you know about the carnage we faced working in Karachi at our hospitals?" Imtiaz nodded. God, those blasts go off so often in Karachi. They were terrible. I remember them from my medical student days. Those were some of the first patients I ever attended. I glanced up at him. We were attending a patient with a badly infected limb. I was surprised to meet his angry stare. He was angry at my sorrow. I gazed at the wound we were inspecting. We had worked on this patient for weeks. Somehow, in the eyes of the doctors around me, our efforts on a single Muslim were worthier than the 3,000 souls who had perished 10,000 miles west of here. I was stupefied. Well, thank you for allowing me to read that, because I was very uncomfortable to read this, and Dr. Luft made clear that I would be allowed to read that. But what that scene is trying to describe is finding yourself as a physician, surrounded by physicians who have profited, as I have, richly from this country, profited intellectually, financially, economically, in every way. I've had nothing but gain from the United States. A gain that translates in foreign countries where you're more valued because you have American education credentials. And then to be around physicians who could not mourn with me, I found repugnant.
Well, I'm sorry. I'm a retired service member, okay? And I have a problem, not with you, but that situation, because let's not forget the first Iraq War, and the United States sent hundreds of thousands of troops to the Middle East to defend Saudi Arabia. And then, of course, when the threat was no longer there, they just said, okay, thanks, see you later, bye, and kicked us out. But yet these pricks got the benefit from us keeping Saddam Hussein from invading their country. And you were stupefied, I'm insulted. I shouldn't be, because there's been a history of this. And it's got my blood boiling, I'm sorry.
I'm so sorry about that.
No, just, and you know, the United States as a whole, we're the worldwide sheriff. We're the guys that, you know, somebody needs their ass kicked up. Yep, send in the Marines, okay. You know.
No, this is a valid point. For me, it was also the people that were around me, I saw them no differently than me. We had come here trained by some of the same professors, some of whom are still appointed here, lived and worked and enjoyed ourselves in the same city, but had completely different responses. And I actually left the environment a few weeks after. That wasn't the reason. I was leaving anyway, but I realized that this was not a place for me. But if we think about people that are going to become physicians, and I think about this now, I describe somebody in the scene who is reading an X-ray, who had revealed himself to be a Holocaust denier some months earlier. And I remember at that moment, because I knew about the Holocaust, because I'm educated, and I had no words for someone who could deny that. I didn't actually know what to say. It was quite scary, and so I was silenced. And it's only now, when I think about this, as a physician, you say that we may have to take care of people that conflict with our worldview. That's often the case. I don't remember it really affecting me. But when you have a physician peer who may share a worldview that might be incompatible with yours, I now believe at my age that there is a moral responsibility to act on that. And I don't know what the action would be. I've actually asked my mentors about what they would do. But there is some compulsion, and part of the way that I can act, or you can act, is by telling the story. This chapter I was reluctant to write. Both of my editor and my publisher and my agent are all Jewish Americans just by chance. So I told them I didn't think there would be any good in writing this chapter, and perhaps they better leave it alone, because it could cause now pain 10 years later, as it's causing pain to you, and it makes me very uncomfortable. And the answer I was given is that no, this is just like people who didn't want to talk about the Holocaust. You have to talk about what happened from your view, because that becomes an important story. I think that by writing this, it definitely doesn't matter, really what happens to the book, was it a success or not. but it made me realize that I have an ability to be a voice for things I have seen or things that I care about or things that I value. And that's a very fortunate thing, but as doctors you're very well placed to do if you do it respectfully. Because every day you will see patients who have experiences that you are never going to see. You'll never live those experiences that your patients will be living. And they come into your office and they share experiences with you. As my mentor used to tell me, a patient will share their experiences with you more than they will to a priest or a minister or even a lawyer. There's still a very special relationship that a patient has with their doctor. So it's very valuable. I didn't write about stories of patients in there specifically, but I wrote about what I saw as a doctor. And I think if we gain anything from the Oral History Project, it's that it's a privilege to have this view and vantage, but it may become a powerful tool for good if you want to exercise that at some point.
I think what you said took a lot of balls, and it's very true. They tell you even in the police department, listen, don't bring your own baggage into the fucking job. You're going to be called in to do, you know, that's the way it is. I warned them already. That's how I speak.
Doesn't sugarcoat it.
No, it's we'll have an audio difficulty. What I think
You can't do that.
is true. It's you know, you're going to be asked to handle you know, family disputes, and you gotta have, and that's what, you know, is different about a New York City police officer more than other places, because it's such a melting pot, is you have to understand different cultures. There's a way you handle going to a family dispute in a Spanish household, you know, American household, a Hasidic household, a Muslim household. There's different things, you know, to get, you know, there's a different way of handling it, and, you know, you learn to work around it. You know, you get done what you have to do, but rather than hitting the hornet's nest, you do it very tactfully with respect. What's got to be done is going to get done anyway. But and try not to bring your own stuff into it.
I'd have to imagine that you would also get calls, and sometimes the person you might be helping, and on an average day you would never agree with them. You would never want to help them.
I've
But as a
gotten
doctor,
called
you're
to
the same.
handle people that have called me for help that hate me.
Yeah.
Hate me either because I'm white, hate me because I'm a cop, but they still called me. So I still have to fix their problem. You gotta let that roll off you. You gotta let it roll off you, because it'll get in the way of doing what you're doing.
Same as doctors.
You will not be able
Patients.
to, you will not be able to function.
It shouldn't be that hard. We're cops, we make $60,000 a year, and we're taught every ethnicity in the city of New York and how to handle it. You cannot put your hat down on a Hasidic woman's, you're in a Hasidic house, because it means you're sleeping with a white. You can't arrest them and put them in a radio car on a Sabbath. You can't put a Hispanic man in handcuffs after you arrest him. You take him outside of this.
Away from the family.
Away from the family, because machismo. We learn it all as doctors, and you're making, I don't know, maybe not nothing now. And I have friends who are doctors for 20 years, not making anything either. But you know, you're well educated. This should be absolutely no problem to you to understand every culture and just take it like, hey, it's like as a police officer, we put on a costume, we go out there and we put on a show every day.
And if you can't,
as
tap
doctors,
out
you should do that too.
and ask someone, listen, you mind taking this? This is not, you have to understand when you're in a personality thing and it's just not happening. You learn it in hostage negotiations and everything. You might have done 10 in a row and talked the guy out instead of getting into a shootout. It's not working with this guy. And they'll tell you, you're an asshole, get me someone else. Get me your boss. Could be another cop. Okay, I'm out. It's not working. The objective is to either fix your patient, get them up and running, or handle whatever you gotta do as a cop. It's the same thing. You gotta lose all that shit. Everybody has their own stuff. How you feel when you drive home, that's fine. But while you're here, you gotta do what you gotta do. That's the end of it.
Thinking out of the box too. You're doctors, you go to so much school, this. What about that small town doctor who doesn't have access to everything you have and he thinks of another way to do it? I wish that someone would do that with us. You get this giant pool of guinea pigs, and You're just throwing medicine at us. I got a new doctor recently, an old-time rheumatologist. He did the study for when the silicone implants were starting to leak. He was on that big team. And he said, we were losing our minds, right? These women were getting so sick. They had to think out of the box and think autoimmune and think all this other stuff. And he goes, we weren't fixing a lot of these women. But thinking out of the box. You go through school, like I go through the police academy, and then I get this job. They're like, oh my God, they didn't teach me how to do that. I'm going to get a rope. I'm going to tie it to the back of the radio car. I'm going to rip this window. I'm going to get in to get this person. Got to think out of the box. Don't always think in the book. You know, it's
Use
a
your
guide.
head.
What you learn is a guide. Just
Trust
like
your,
what
trust your gut, trust your feeling. You know, we always knew when we get into something, you could feel, you just get like tingling on the back. This is not good.
When
This
your
is
hair
not,
stands up, it's standing up for a reason.
trust
Yes.
those feelings.
And I think what you're also talking about, or I don't think I knew it at the time, but later on, is you have to be true to your own morals. And my mentors are in Long Island, so I would talk to them from Riyadh before these events happen, and sometimes I tell them things that I was very worried about. And Dr. Niederman is my mentor, and he said, if you find that you are practicing in a place which you think is morally or ethically corrupt, it's your responsibility to leave that place. That was before we knew these events. But if we think about the stories we've heard earlier on today, when you kept saying you were embarrassed, what I was thinking is I would be embarrassed for my profession or my city or my government to see that process where one person is asleep, two people haven't read the records, and this is passing as an execution for some of the humane laws that we have in the United States. So that's where whatever the motives are for the people that were on that board, and I can't criticize colleagues, I don't know what they were doing, whatever their motives are, that's something that you wouldn't perhaps want to be part of if it wasn't done to your satisfaction as a physician, which you would only have a level of satisfaction if you had taken the time to listen to the stories being told. If you didn't really listen to the stories being told, you wouldn't feel connected or invested to the people that you're trying to help. And when it comes to narrative medicine, a lot of the doctors who hear about it say, oh my God, I've got no time for this, I only have 3 or 4 or 5 minutes. However, it often takes only 1 or 2 visits where you've heard a fragment of a patient's story. So often in my office it happens, I'll see a piece of jewelry or I'll see a tattoo and I just wonder what the story is. So they'll tell you a short story, and then the next visit you remember a fragment and the patient feels heard. And you get through the blood pressure management so much faster because the patient knows someone is listening.
And that listening in and of itself, even if nothing else happens, is healing.
Talking about, you know, you being in Saudi Arabia and feeling uncomfortable after the events of 9/11, I was in Iraq with the Air Force, and we had medevac, you know, dust-off missions coming in with guys that got hit by a roadside bomb and ambush.
Iraqi people?
No,
American
U.S. soldiers,
soldiers.
and sometimes Iraqi civilians. And we're working on 2 or 3 guys in the trauma room, and then there's another medevac chopper coming in. It's one of the bastards who tried killing these guys. And we're offloading them, and the flight medics are working on them, and the doctors and nurses in the trauma room are doing the same job that they offer our troops. You know, and they're getting the same quality of care.
Yeah, so they had to overcome their...
And you may very well be faced with that same difficult choice. And knowing that if this guy got off the tip, he'd probably try and kill you, because that was he was set out to do, you know. But, you know.
This actually ties very strongly in with the Holocaust. There's a field of Holocaust medicine, and one of the very diabolical truths about the Holocaust is that it was greatly facilitated, aided, and actually, I don't know if originated is the word, but the medical profession was very involved in the theoretical concepts, in the development of it, in the execution of it, and in the silencing of it. And the reason I thought of it now is just as you're talking, those physicians who were helping the IED bomber must have had lots of feelings, especially if they saw the work of the IED bomber 2 bays over. They must have had feelings that they were erasing This week, if any of you saw in the New York Times, there's a troubling opinion editorial, Gitmo is killing me. And you read the opinion editorial, it's short, and it's written in the first person of a person being held there, and describes having nasogastric feeding. Okay, that when you probably already know how to put a nasogastric tube in someone, it's the first thing I learned as a medical student. So, leaving the politics aside, I'm not informed on that at all. But if you read the account of the voice, which is a voice of a prisoner, but also a patient and maybe a terrorist, I'm just thinking, I can't believe what this says about the medical personnel that are writing the orders or doing the act, whether they think it's right or wrong. Something has been lost in our profession. All of you should read that.
How about you talking about talking to the patient and knowing the patient and stuff like that? The doctors are really responsible for whoever's working for them. Don't double book patients.
Yes.
Leave yourself time.
Yes.
You know, give yourself 15 minutes or 20 minutes or a half hour.
Yeah.
So because now you're getting double booking, and I understand emergencies walk in, that's great. You know, you have to take care of these people. That's fine, but not every 10 minutes book a patient and then you're in there for 20 minutes,
That's
a half
exactly
hour,
right.
and then you end up 3 hours in the doctor's office.
You know why that happens? Because the medical profession no longer places a value on actual getting better. That they don't place a value on speaking. That's why they place a value on the number of stents or the number of, I don't know, how you would measure it, procedures. There's no value ascribed to talking. And
Like
I'm not justifying it.
I have a
think it's,
physician I really like. I either get the first appointment or
yes,
the last appointment.
that's what I tell a lot of
That's
patients
it,
to do.
you know, and
Yeah.
I don't want to give up that doctor, but that's how I deal with it. And, you know, people get disgusted.
I was gonna say, subsequent to 9/11, I ended up going for my EMT certification. And out of all
What is that? I don't know.
emergency medical technician. Okay, and
EMT.
one of the best parts of the training was, yeah, you're gonna figure out the airway and the breathing and circulation. That's, you know, that you better figure out, okay? But more important was taking the time to establish a rapport with the individual, because I'm not their doctor. They're not coming to me on a regular basis. And in the time that I have with them in their home or wherever, I need to earn that trust. So they will open up and talk about what's really going on, because they don't know me, and chances are they're not gonna wanna tell me, oh yeah, by the way, I took cocaine, or I did this, or I did that. Whereas, because they may think maybe I'm gonna judge them, you know, and I have to establish in a short amount of time, you know, that rapport where they're gonna feel comfortable opening up so we can get to the treatment and the stabilization.
So Rob, can you share with us, how do you do that?
Mm-hmm. Good question.
I think some of it's through eye contact, okay? Some of it's just smiling, okay, and trying to put them at ease. Again, maybe you're saying you saw a tattoo or something like that, you know. Maybe you see a picture in the person's home. Oh, you have kids, great, you know, you have grandkids, you know, and just talk to them. Talk to them like a person, not like just somebody sitting in front of them so you can clear the call and get to the next one.
Mm-hmm.
You know what I'm saying?
I went through this whole thing with coming down with autoimmune stuff, psoriatic arthritis. Well, my hands went down to, actually, you could see the bone in a few places. And I found a great dermatologist who actually went against everything, like was giving me the injections in my fingers of steroids, like way above of what, you know, what would be paid for. She would just do it. And then it got so bad that I actually was having these hysterical crying meltdowns in her office. And let me tell you, this is a good doctor when she does this. Closes the door, cancels the next patient, and then gives you her business card and her home phone number, her cell phone number, anytime you need me. Because she saw how bad it was. You know, it became such a point where she really became a part of my care, really, and almost, like, not friendly, because she's still my doctor, but you could tell she really was empathetic even, because she said she had that's why she became a dermatologist. So she had an empathy more than a sympathy for me, you know? And it was, it's a great thing when you know someone's really, really, really trying all kinds of different meds, trying all kinds of different stuff, until they got something that could kind of work halfway decent, you know? It means a lot to the patient.
How-
I mean,
how-
really, not
how
having a
could-
meltdown.
How could you tell that this doctor had empathy compared to other doctors? You
Well,
must
she-
have met a lot of
When I
doctors
had
by
my
now.
meltdown, she said, you know, there's a reason why I became a dermatologist. She goes, I have a history personally myself. She let me into a little tiny piece, did nothing more, just a little tiny piece, and said, so I totally understand what you're going through. And
Wow.
we're going to fix this, no matter what it takes. She had such a confidence about it. And meanwhile, it wasn't working for quite some time. We had tried, 5 different medicines, which is, I go home for a week and have to suffer. Then I have to try another, it took a long time, but
So she told you a piece of her story
yeah.
that
and she
made
said,
you feel
this is
better.
why, I said, nobody's listening to me. I was going to a million doctors, I said, my hands are rotting away, I can't close them, and no one is giving me any medicine, no one's doing anything for me. And that's what she said, sit and listen for a minute. She goes, the reason, she gave me a little piece to tell me why she was gonna help me. And then I said, I'm sticking with this
You
doctor.
know what's so incredible about this story is you never think about anybody even talking to a dermatologist. I just think about a dermatologist looking in a camera and doing a
Well,
biopsy
you don't
behind
have
me.
a serious health problem.
So, no,
I'm not
I'm
going for Botox.
No, I'm not suggesting that at all. But the image of a dermatologist as someone ministering with care
She
is
was also somewhat
unusual.
cop-like in the very beginning when it was so bad. She goes, well, I can put you on a couple of pills or I can really fix this, but it's going to be really painful. And I go, bring it on. She goes, all right. Just one of those kind of things like, let's do it. And then she started injections and it was so painful, but it was started to work. And another bed on top of it didn't work, and another one didn't work, and another one did work. And so it's a process.
Well, I think one thing, Dr. Mike, you brought up is this idea that doctors are observers. And like you described, looking through a machine at a condition. And another way of observation is by asking questions and
Yes.
asking the right questions. And the only
Yes.
way to ask those questions is to first listen. Because you may be asking the wrong questions and not even
Yes.
realize it.
Very good. And in fact, that's exactly what Bill said, which is if only they came up with a better word. I think it was Bill, you said rather than a monitoring program, makes it sound, you used the word
Right.
guinea pigs. It makes it sound like we just are these people that
We
are
already have
disconnected.
expectations
Yeah.
of what we're going to find and we're just waiting for them to happen, right? That's the message I got from you. Rather than entering it into trying to understand what could be, we already think we know what the answers
Just
will
throw
be.
medicine at us. Do something. Throw us all into a hyperbaric chamber. Try some crazy, nutrition. Try some. I read all that all this cancer, people curing themselves from cancer with all these, herbal medicines and stuff that's really working, and.
Rob, I think you have a question.
I just wanted to, sorry Robin, I'll be quiet.
Okay.
But Carol, I just had a thought. I think maybe the reason your doctor was so good is she knew what it was like to be a patient. Oh,
Yeah,
sorry,
and
Christine.
you know what? She saw that I was.
She
this
had
is-
been a patient.
Nobody
That's
was listening to me
what
about
she
my hands.
understood
They
it.
thought I was like lying or something. And she finally listened. I go, no one's caring
Doctor
enough to
patient.
fix my hands because I've been to a million doctors. Either they don't care enough or they don't know how to.
Yeah.
And I confronted her with that. And she said, well, I know how to and I care because.
Yes, she
She gave me a reason,
One of the things that I'd like to take away from the whole thing is, especially for what you're going through, I learned the phrase, treat person, not the machine.
Oh, yes, you were
Because if you look, for example, a perfect example is a pulse oximeter. Okay, when you measure it, when you put your little clip on somebody's finger and says, oh look, the saturation's 100. Oh, that's great. Well, guess what? Carbon monoxide still shows up as 100. So treat the person, not the machine.
I just have a question for you. If you were to go back to that day after September 11th in Saudi Arabia, would you have said something now, or would you still not have because it would have been too scary?
I didn't. I only read you a fragment. I spoke out very vociferously in defense of America, and I did that in shops where it was so prevalent. I would pay for something, give my money, and the shopkeeper, who was obviously not very educated, would say how wonderful this event was, and I disciplined him in public that this was my home, my friends, some of my family lived there,
You damn
and
infidel.
it was profoundly un-Islamic to celebrate. So I did that. About the person who publicly denied the Holocaust did so in front of two of my colleagues who were Polish, and one of them has a cousin who's a tour guide at Krakow. So it was like a cartoon, the scene. I think at this age, I was only 31 then, so now I'm a lot older. I would probably have the voice to be able to say this is unacceptable, and I would probably go to whoever was in charge and say, I'm not comfortable with a physician who has these views, because we were critical care physicians, so we're making life and death decisions on these patients who sometimes we didn't know who they were. Like they've said in Boston, there are some people they can't identify, who certainly can't speak for themselves. There's a very difficult structure in Saudi Arabia, which you know about now, it's been in the press. There's a lot of foreign, migrant, extremely poor labor. So they don't have any money, any advocates. So there are a lot of, I never wrote about it in the book, but I did not always see patients treated equally in that environment, because we were the first responders in the hospital for critically ill patients. Towards the end of my time there, colleagues felt that we were not paged quickly enough for the poor Bengali that was a trauma victim as we were for this Saudi that was in a motor vehicle accident. So we would get to those patients when it was way too late into their shock to help them. So there were those things I never put in here. But it's easy to say in hindsight. And I still, to some degree, while I've made it public in here, all the names are changed in here except for myself and one or two characters. But I haven't exposed that person as much as I could have done. And I talked to my mentor about this because physicians have long careers, so they continue to publish, they continue to go to national meetings, they get very prestigious grants. And I haven't called up and said, hey, this guy that has this grant in this journal is a Holocaust denier. Do you want to excommunicate him from him professionally? So this is the debate I had with my mentor, who's also a Jewish American physician. And we didn't really know the answer as to what you're supposed to do. But if you had a colleague who said, who may be subscribing to something that we think is completely socially unacceptable, who knows what it could be, but let's say something easy like a racism or something like sexism. There are laws and there are ways that you can start to process that. So I think I would say something about it. I don't know what. And I hope you don't encounter circumstances like this. And I hope I never encounter them again. I think the reason people feel like these people described in this book is most of the world does not know America personally. Even though it's a huge country, 300 million people live here, they do not know an American. They have not traveled here, but they may know only of some American actions.
Are you a Muslim?
Yeah, I'm a Muslim.
Can I ask just one question? How come not one Muslim has turned into like a Martin Luther King and spoke against this, really come up and rose up and said, stop this killing? Why
Yeah,
is
there
not
actually
one
have been many. There have been many,
if there
but
was some,
Martin
we would know, you know? I watch the news every day.
Martin Luther King is a figure, he's a statuesque figure. So I don't know of someone I would equate to him. Like there hasn't been a Mahatma Gandhi, let's say that, or a Martin Luther King. But one of the questions in here was, how does telling your story as a physician change you? One of the ways it changed me is I didn't know when I wrote this book 5 years ago that one day your colleagues would be my patients. There's no way to predict that I would not be in an ICU anymore, but I would be taking care of insomnia and PTSD and so forth. But because I'd lived there, even when I meet my patients and they don't know where I've been or they're not interested what my other career has been, their experiences changed me in a way that then, when I was invited to testify on the behalf of certain valuable things, I was asked as a Muslim to testify, and I decided to do that. So there were 3 or 4 American Muslims, I'm a British Muslim, who decided to testify in support of some of the activities that Peter King has been investigating, like more surveillance, more information. So there aren't statuesque figures that I know of, but there are many citizens that are filling this void that you're speaking to.
There is a void there, I mean,
There's a void?
someone could really become great.
There
Because
is a
there
void.
are a lot of peace-loving Muslims, we know that.
Yeah.
We just don't see them because they don't stand up, you know?
Well, that's one
It's a
thing.
shame.
The other thing is, I really believe this, is just like we started the beginning of the hour, that there are 1,300 of your fellow men and women who are no longer here because of complications, but the country doesn't know that story. This is why narrative is so important. It's not that there aren't people that are accomplishing much more than I'm ever likely to accomplish. It's the narrative is very firmly contested. So one of the reasons why you 10 or 12 years after 9/11 are describing scenes where it sounds like you're not being heard, not being listened to, not being advocated for, is the narrative has not been in your favor. That's not for any shortage of anything you did. This is a story that most of my physician colleagues don't know unless they're looking after patients like this, let alone the rest of the country. So I think that there is a lack of, there are a few people, there is a lack of desire to even say things like this. That's the other thing the physicians need to learn is if you start saying anything publicly, there are huge consequences.
Yeah.
And we can talk about that later. All of you know that. But if you say something consequential, there will be consequential actions, and some of them can be very good, and some of them can be very painful.
I have a question for the responders on that
Yeah.
note, who, knowing when you decided to participate in an oral history project with us, we were very clearly stated that we would like to create a documentary for public display. We'd like to create this book for public display, and you all agreed, that you would be willing to have your story in the Library of Congress and really displayed publicly. It wasn't just with a few people. And has that impacted you? I mean, how has that impacted you? Some of you may have seen the documentary and you were with an audience of fellow citizens, people who knew nothing, to have your story out there so publicly. How did that impact you positively? Was there challenges with that? I'm just curious in hearing.
My grandniece watched it, and then I went on a cruise with my whole family, and my project the entire week on a cruise was to convince my grandniece I was not.
Oh, sweet.
That was my job for the whole week,
Mm-hmm.
My niece
How
told
old
me,
was your-
convince your granny she's not gonna die.
How old?
5
5.
at the time, yeah.
I despise the fact when anybody calls me a hero.
I would
despise it.
She's
What a
a
word.
hero.
Yeah, I really do not like to be called a hero. I always joke around with Dr. Loft, that's, roast beef, lettuce, and tomato. And
Love
that the
St.
heroes really died that day,
Yeah.
and here I live in Survivors Guilds, because I always feel like I should have done more, and then I go back, what would I do different, and really nothing, I just wish it could have got done quicker.
But that word is so strong that you said that you despise it. Why do you despise those who would use it, that they don't even understand, or what do you mean by despise?
I think that everybody here sitting with me, if you were to call any one of these people here a hero, I don't think any of them would like it.
Heroes
What are you talking about?
All the heroes are dead. That's the truth.
Yeah.
You don't see your survival as heroic?
No.
No, it's the right thing to do. Everybody who ran in and did what they did, it's because.
Whether you had good instincts to stay alive, that's about it.
But
It was our
it was
job.
the right thing to do. People needed help, and that's what all of us here do,
So these people that we saw in Boston on Monday, do you think they were heroic?
I think they were.
You think they were heroic?
I think they
Yes.
were all, because there's always a possibility that there's gonna be a second device or
And
a
there
third
was.
device.
And there was,
And,
there
uh,
was.
They didn't even think about it, they just ran
Hmm.
to help people.
And how is that different from what all of you did for us?
Well, we
Because it's us.
I think
Basically,
there's
the buildings already came down.
But you
I don't
didn't
think-
know if there could be more?
Well, I think what's really interesting here, and I know I've spoken with many of you on this topic a lot, is the cheapening of what you experience by that term hero. Like, our society uses that term and we can throw it out and
Devalue it.
apply it to people all over, but your experiences are so rich and you went through so much that I think that just applying a simple term like that really doesn't give you justice, you know.
I work with people who got the Medal of Valor because they were ordered to stay behind and answer phones. Meanwhile, I had a 110-story building come down around me. I happened to be outside the collapse zone. I'm fortunate 3 of my colleagues perished. But this guy here walks around, you know, I'm a hero. You know, go fuck yourself. You're not, you're a coward. I'm sorry, you know. If you want to use that word, then why didn't you run towards it like everybody else? I don't know. They told me to stay back and answer phones, so I'm going to answer the phones. I just...
As the wife of a first responder, this process, I've noticed on some level it can be so cathartic and so validating, and then on another level, so reactivating. That there's almost a need. Last week when we went home, Bill kind of relaxes and decompresses by way of his motorcycle. He's like, I need to get on the bike for a while. And I knew, because any discussion, so it's almost like a balance, I think, in giving a narrative.
Right.
Actually, this is a brilliant observation because I was just reading about it today, and that is that the storyteller and the story listener, they approach the story, and each has to approach and retreat.
Dance almost.
It's the same over time, and it's the same as in grief. That's how grief and bereavement is explained, is periodically exposing yourself to little parts of the story and then avoiding, and that's healthy. I wanted to say one thing because Elliot asked a really profound question, but we never got to really talk about it, and we've only got 5 minutes, where you said you thought it was a really, I can't remember the expression, basic or base value to bear witness. What did you mean by that, and why do you think that is? I don't think you were referring just to the profession. I thought you were referring to human beings.
I guess. I mean, elaborate more on how you interpreted it.
Well, I agree with what you were saying, which is I think to bear witness is a profound value, but it's something that I really haven't thought about until the last year and a half, where somebody called me up and officially asked me to be a witness in a hearing. So I began thinking about, well, I didn't see a crime. It's not like I go into the witness, like when somebody's murdered someone and you need a witness, is how I think about it. But I think that if there is no one to tell a story to, it is as if it never happened. And I think that's why I'm going to give you an article that talks about the Holocaust as an event with no witness. Even though later on there were witnesses, a lot of times while it was happening, there were either executioners or willing executioners or silent, people that didn't do anything but enabled it, and those that attempted to survive. So one is, witnessing is important because it means that we exist. One is to give someone the chance to bear witness, which is I think what we've tried to do today and last week and hopefully next week with all of you, is just by being here, we are helping someone bear witness. The witness himself or herself gets to actually be a witness to themselves when they tell their story. So at the beginning, Christine said, I didn't want to do it, but my friends told me, so I did do it. So you were able to be a witness to yourself by telling your story. And then all of us, the people who are filming this for us, or some people who've been maybe quiet and not said anything, are seeing the whole process of witness. So there are 3 levels of witnessing. And whatever, you might change roles. Like you're all witnesses, but you're listening to each other's stories, so you're bearing witness and also witness to someone else's testimony. This is fundamental. This is also the reason why there was such an effort to eradicate a group during the Holocaust. They didn't want to just exterminate a group, they wanted to eradicate all possible memory. And that's why eradication of memory or denial of an event, whether it's the Holocaust or another genocide, is such a profound assault. Even if there's no one left alive, it's a profound assault on humanity. So I've been a doctor 25 years now, but it's only until the last year that I realized when a patient comes and tells me that they're sleepwalking or they can't go to sleep or they have a cough, it may seem minor, but just by them telling your story, you are validating some of their suffering, and if you're any good, you'll be able to solve some of it. So that's why I thought, and that's why you don't have to be a doctor to do this. You could be a neighbor, you could be a friend, you could be a priest, you could be a politician. And when you say that nobody remembers us or the police department doesn't listen to us, to me it's like an abandonment of the responsibility, not just financial, but of acknowledging that the event occurred.
It's an old saying in the police department, when you hear you're a guest, when you're gone, you're a pest.
You hear you're a guest,
When you're gone, you're a pest.
and this is their saying, a colloquial saying.
It's the truth.
It's actually when you hear you're the best, when you're gone.
See, you always say things in such effective nutshells. I'm such a windbag.
Well, in interest of time, I know all the students have to leave, so I want to thank you for an excellent discussion, great questions,
Privilege.
And it's been a great privilege to have all of our responders
Thank you
here
for
to help
moderating
us.
it so well, Julie.
Thank you.
Go on, do great things.
Thank you.
Put us in that bubble, fix us.
Yeah, you gotta think about it.
I don't know what to say to this, but when she was saying about the French doctorate, she was that in there. That's exactly the kind of target thing.